So I'm gonna demo the Foley Cath insertion. Obviously my mannequin's missing the majority of his body. So when you go in, you'll take in your Foley Cath kit. You guys will have one to practice with that you can use, and then you'll have a brand new one that you'll do on your patient. Make sure you have the right patient when you go in. You have your 2 identifiers. Make sure if they have an allergy to latex. So this Cath kit does have a latex coating, so make sure that they don't have that allergy. You have all your supplies. You're going to wash your hands. Obviously for this, you are providing your privacy. This is my imaginary curtain. If they already have a Foley catheter in, you're going to, after you wash your hands, put your gloves on, get your 10 cc syringe, pull back that balloon so it's empty, and then take out your old catheter. Before you remove it, you're going to say a little pressure, pull it out, and you're going to discard that entire Foley. Then you're going to wash your hands again after you take your gloves off if you've removed the old Foley. You're going to bring your bed up to working height and position your patient. How would you position a male? Supine. And then obviously you don't have to open his legs as wide as a female, but you open them enough that you have a little bit of space to work in. You're going to have a bedside table too. This is my bedside table. This would be normally where your patient's body is, but it's my bedside table for now. You're going to open your Foley catheter kit. Your hands are clean. You do not have your sterile gloves on yet at this point. You could have a trash can close by. Sometimes I put all my trash on the end of the bed and just discard everything once the skill is done. So you take everything. Remember, this is a sterile technique. So what do you open this with? Just using the corners. So you're going to open just using those corners, because remember, if it flaps back over, it's still sterile because you just touched those corners. And you're going to open your kit. Sometimes you have to mess with this and pull these away from each other to get them to open. But if you have a badge that's hanging down or hair, make sure your hair's up, your badge is back, so you are not breaking that sterile field. Sometimes they're tricky. They don't want to open up. You can reach on the outside and manipulate it how you need to. Now, before you put on your sterile gloves, you're going to drape your patient. Your drape is sterile. So you're going to grab the corner, open this up, and you're going to drape it between your patient's legs. You can ask them to lift their hips, tuck that underneath, take your corners. You're not going to touch in the center of this field. You want this to stay as sterile as possible. Obviously, you've touched this with your clean hands, so the corners aren't sterile, but the center of your field is. Then I'm going to set up my kit here. I take off my box here and I'm going to set this off to the side. So this isn't sterile anymore because I touched it. Then I'm going to take my sterile gloves, take them by the corner. Remember, we did this for dry sterile dressing. You're going to find a space where you're not messing up your sterile field at all. You're opening these from the corners again. And again, just like you did with your kit, you might have to pull opposite corners apart to keep those open. And take your time with this. If this is frustrating, just take your time so you don't break your sterile field. Remember, you take your thumb underneath and you pinch that opposite hand. Put your hands in here. If you have really large hands, you can grab a separate pair of larger sterile gloves. Pull that down, then you put your fingers inside that cuff and your hands go in, or your hand. So then there's your sterile gloves. Remember, once you're at this point, you don't want to touch anything that is non-sterile. I'm going to set up my kit now. So I've got my Foley catheter that has this little cover on it. So I'm going to take this cover off. You want it to stay sterile, so kind of fish it out of there. If you just whip this off, this might go flying. If this touches something outside of your sterile field, you have to get a new catheter and start over. So be very careful with that. When you discard, just drop it from a little bit high. Don't put your hand on there, because if you hit the trash, then you've broken your sterile field again. This drape, some people use and they'll put over their patient. I don't use this drape because then you have to rip it off after you have your catheter in here. So I'm just going to discard that. You have your iodine swabs. This is something we're just going to simulate because we're not going to use these on the mannequins, but you're going to simulate that you open it and put it in your pack so it's ready to be used. This is if you get a urine specimen. We're not going to get a urine specimen for your test off, but just know that you date and label this specimen cup. So I'm going to throw that in my trash as well. And then with my lubricant, you're not gonna use lubricants on these mannequins. So you're gonna simulate that you open it, and I like to take the tip of this and stick it in my lubricant bag and just have it off to the side so it's ready to go. Instead of, some people put their lubricant in this tray and take all of it to the bedside. I just think it's easier to have everything in this one box ready to pull out. And then you have your 10 cc syringe that you're gonna blow up that balloon with. When you blow up your balloon, you're gonna connect it into this port down here. You do not have to test your balloon before you insert now. When I was trained, they had you blow it up just to make sure that that balloon didn't burst. Now they don't recommend that because they want it to be as intact as possible. But this is what the balloon looks like once it's inside of the bladder, and you put all 10 cc's inside of that. So I'm gonna remove that 10 cc's of saline so it's ready to go, and I'm gonna leave that syringe attached. If for some reason the syringe comes off when you're cleaning or something, you can put it back on, but you'll only have one hand to do that with. So I'm gonna put my syringe in there, my tip of my catheter, and put it back in my lubrication. So this is ready to go now. I'm gonna take my kit, pick it up, and put it in between the patient's legs. There are different ways to do this. You don't have to put the kit in between the legs. You can use the bedside table. I find it easier to place on my sterile field here because it's closer to insertion site. Now I'm gonna clean my patient. So I have my swabs out, and if this was a female, you're gonna take your non-dominant hand. So I am on the right side of my patient since I'm right-handed. If my dominant hand was my left side, I'd be on the other side of my patient. With the male, you're gonna hold the penis. If he has a foreskin, you're gonna pull the foreskin back. To clean the male, you take one swab stick, you're gonna go from the meatus, circle out, and toss that one. You're gonna take the second one, meatus, and around a little further, toss. Third one, same thing, and around, and throw it away. This hand that's holding the penis, you are not going to remove that hand now, because you're gonna be tempted to grab something. This hand is dirty. You don't use it for anything else sterile now, it stays there. If it's a female, you're inserting the catheter. You take the labia and you spread it. You take one of your Q-tips from top to bottom, down one side, toss it. Another Q-tip top to bottom on the other side, toss. Last swab stick, top to bottom, straight down the middle, toss that. You keep your fingers there, keep it spread, because if you close it, then you have to re-clean. And I was holding this the whole time. All right, now I'm ready for insertion. So I've got my lubricated tip. For the female, I think it's 2 inches. For the male, it's a little bit longer that you lubricate this. So I'm gonna let my patient know I'm gonna insert your catheter now. Might be a little tender, a little pressure. This probably won't work with this mannequin, so I'm just gonna simulate. So you're gonna put in your catheter. Once you get a urine flow back, how much further do you insert your catheter?
1 to 2 inches.
1 to 2 more inches. So we're gonna go ahead and insert that further and hold this. And now you can take your dirty hand and hold it down here. So this is inside of them, and you're gonna blow up your balloon. You're gonna fill up all that balloon with all 10 cc's, and you're gonna pull that syringe off, and that's trash. Then you're gonna pull your catheter back until you meet resistance, so that balloon is snugly in the bladder. Ask your patient how they tolerate it, how they feel. You're gonna take out your catheter bag. If this hand has lubrication all over it from cleaning your patient, especially with a female, just be careful. A lot of people, if they go to secure it, they'll use their pinky to hold this to help fill that balloon. This hand just shouldn't have any lubrication on it, so you can take your catheter bag out of your box. Sometimes I take my glove off if there's lubrication all over it, and then I go ahead, I can manipulate this then. And you're gonna hang it on the non-moving part of the bed. What level do we want it to the bladder? You always want it below the bladder. Then you're gonna take your, whether you have tape or one of those leg stickers, you're gonna secure it to the leg. That is part of your test off. You say, I secure it to the leg. And then you're gonna document what color is your urine, what color do you want it to be? Yellow, straw colored. If it has sediment, no sediment, and you're gonna leave that hook there. So let's pretend that's hooked to our patient. You're gonna wash your hands. If you want to get clean gloves on to clean everything up, if there's lubrication on it or anything dirty, put gloves on, clean up your site. cover your patient. Sometimes your patient has lubrication on them. You'll want to clean them up, wipe them off, make sure they're comfortable. Put their gown over them, give them a call light, open up the privacy curtain. Before you leave your patient, what's the last thing you do? Wash your hands, the very last thing, and then leave and you put in your documentation. That's it? Okay.